Discover KDH Collective's Leaning into Therapy podcast, an enlightening exploration of therapeutic approaches and evidence-based protocols. Join us as we delve into the vast landscape of therapeutic interventions, guided by the belief that collective intelligence surpasses individual expertise. Led by KD Holmes, a licensed professional counselor with 16 years in private practice. This series offers valuable insights, expertise, and training from a team of skilled therapists. Prepare to immerse yourself in the world of therapy, created exclusively for therapists by therapists.
Today, Keisha and I are talking about ketamine-assisted psychotherapy, and Keisha has done a deep dive into this incredible area of study, and she's got some close connections. And so today I'm going to be really asking her a lot of what she knows, and hopefully we're going to share our geeking out on this topic. Keisha, tell us, how did you get interested in ketamine adjacent therapy, psychotherapy, or assisted psychotherapy?
I'll tell you the difference. But so my brother is an owner in a facility in Lafayette, Louisiana that does ketamine treatments for treatment-resistant depression. And so I've been in the clinic where this is happening for a long time. And I had friends that were starting to get into CAP, which is ketamine-assisted psychotherapy. And that is a specific training you take, right? It's like, I don't know, $3,000 all the way up to $7,000, $11,000 to get trained in this type of therapy. I am not going to be a facilitator of those types of processes. That's where you're in the office with people when they're going through their ketamine experience. But I wanted to figure out how to assist clients going through it as therapists. How do we help our clients without being present in? Because not everybody can afford $11,000 or even $4,000, $3,000 to get trained, right? And the $3,000 ones, you have to fly there, you have to pay to stay. I mean, so again, very expensive.
And as it becomes more popular, so I am next door to a ketamine clinic. It's a nurse practitioner. She worked at Mayo Clinic. She really believes in it. She left Mayo Clinic, opened a ketamine clinic for treatment-resistant depression. And of course, we're going to, as this treatment becomes more popular, we're going to have clients who go and do ketamine therapy. And so if we are already their therapist, and knowing how to support them through this journey is like key. Because I had kind of a steep learning curve too.
Well, and the research on it is fascinating, but at the same time, it can be, I don't want to say dangerous for our clients, but for some clients, it can destabilize them.
Yes, absolutely.
Knowing how to support them, I think produce better outcomes that are more substantial or that are long lasting. So,
yes. Okay. Tell us about your deep dive.
Okay. So it was a lot of fun. I think these things are a lot of fun. So anyway, as I was trying to understand what ketamine does, right, I needed to understand it biologically, like what is happening in the brain? Why does ketamine work? And as I started to do that deep dive, the reason I want to explain the reason why I got into it is because my brother and them would have these great outcomes and the people weren't even in therapy. And I was just like, what? Like the statistics on it are mind blowing. It's like 65 to 80% effective. This is IV ketamine, not lozenge ketamine. Because the lozenge ketamine is different. Some states allow people to get a prescription of it to take it home and do it at home. The state I'm in Louisiana, you are not allowed to do that. It has to be in a clinic. And I don't even know if they can do lozenge in a clinic. I think they can, but it has to be in the clinic under doctor's supervision. But the clinic that I'm in only does IV. And that is controversial when you get into the CAP stuff, because they like lozenge and they don't really like the IV, which is interesting, right?
Oh, or maybe they don't have, I know the clinic next door, she was a nurse practitioner. Nurse practitioners can operate standalone in the state of Minnesota without they can prescribe without an MD. So I know she does the IV, and I've learned a little bit from her about, she has a great presentation, but yeah, she does IV only.
Well, and what I gathered from it, that the IV is absorbed quicker in your body,
Of
obviously, because it
course.
doesn't go through
Yeah.
your stomach. Um, and it can be like stopped or controlled if somebody's having a bad experience. So
Oh, that makes so much sense.
when they're doing IV, if somebody goes into a K-hole, that's not what they're trying to do, right? They want trans state benefits, which is when they're in higher doses of ketamine, they do want those benefits, but they don't want the K-hole benefits. And I think in what I'm
Wait,
understanding,
what? Explain a K-hole. What is that?
so I don't know a ton about it, but that's the more intense experience where they want you really messed up on the ketamine. They'll say that's the trans state benefits,
Like
but
altered?
it's even more intense. People, like, if that happens, they freak out. Like, they'll scream,
Yeah.
you know, it's a more intense experience. And the way I'm understanding it with IV and ketamine, they're skirting that. They don't want K-hole experience. They want trans benefits, right? Trans state benefits without that overwhelming, intense kind of thing that happens in the K-hole. I don't know enough about K-hole. I just know that we are not, the facility that I'm in does not do that.
Mm-hmm.
And that seems to be the difference between ketamine assisted psychotherapy and IV ketamine. So IV ketamine produces, like, I think they were saying 65 to 80%, 80% effective for people that have failed 2 other treatments. So think treatment resistant depression, they've done an SSRI or an SSNRI. I'm saying it right or wrong, I don't know, but something like that. They've had 2 failed attempts of that. And that's what would qualify them for ketamine, right? So these are treatment resistant depression clients. They might have PTSD, they might have anxiety, but they are not responding to medicine. And I actually did more research because I love to research. So how much does medicine work? I think it's like 50% of clients get better off of antidepressants. 50, that's like, yeah, a chance, right? Almost like only half.
There's a book that just came out of Harvard Psychiatry that says there was like a 12-year study and the results were very low over the 12 years, how they worked. It was like 10%.
Yeah, that's sad. Well, and then
That's really crazy. Well, sorry, it was that in 90% of people, they didn't work for the long term. It was, that's a great book, Brain Energy, out of Harvard Psychiatry, Chris Palmer, MD. Yeah, good book. Okay, keep going.
Couldn't read that book. It was too much. Erica, it was too much. She told me about it. I was like, I just can't do it. But I'll spend 20 hours researching. Go figure. It makes no sense. No sense. I think I like the discovery of it. But anyway, so the reason ketamine works, okay, what is happening in the brain? So people with treatment resistant depression, they are their glutamate, this is what they think, right? This is not certain. This is what they suspect is happening. So in our brain, there is something called glutamate that affects memory, cognition, and mood regulation. And the glutamate is modulated or like regulated through the NMDA receptors. That's what regulates the glutamate. So when it's regulating and people are not responding to their medicine or whatever, right? Glutamate's only, like, say there's 4 things that would fire or connect, only 1 is. This is the simple version of it, right? So glutamate
You're doing a great job.
Glutamate's not working properly. It is not functioning in the way that it could. So when people take ketamine, it is a dissociative anesthetic, but not in the way that we understand dissociation. So it's not dissociation as like a negative thing that happens for people who are highly traumatized, is like they lose time, they're disconnecting from how they feel, but it's not like they see the broader picture. So on ketamine or whatever, a psychedelic, you see the whole picture. So the disassociation creates like this separation from your feelings so that you're able to see all of it in almost a spiritual way. You see, like, in a enlightened way. And when that happens, the glutamate fires completely, right? So when people they do ketamine, the treatment lasts, I think the research was like 4 hours to 24 hours. You see a change in their brain function. And then when they do it repetitively, so at our clinic, they do 6 treatments. So when they do that repetitively, then after 3, it starts to be more substantial and it stays in their body longer.
Mm-hmm.
So when their glutamate is not firing properly, people have cognitive blocks, cognitive loops in therapy. These are the clients that you like doing cognitive challenging and they are like stuck. Their thinking is very rigid. Their brain is not, I think they call it neuroplasticity, which means your brain is adaptable. Your brain is not adaptable when you're depressed. But when you take ketamine, it creates this neuroplasticity, this adaptability in the brain because the glutamate's firing properly. It's exciting it, right? It's why it's so good for depression. Because their brain's like stuck. It's like maladaptive. So when they're on or when they receive ketamine, their brain changes neurologically. It is more adaptable and it's firing properly or better. And so what that creates is more adaptive thinking, more receptive to change, more open. They even have a higher window of tolerance for processing trauma. They're more flexible in their thinking. I'm pretty sure the psychological flexibility is better. So you're getting this window of opportunity as a therapist to piggyback on it and to create substantial change in their life through behavior changes, thought changes. I mean, it's pretty amazing what it does.
Yeah, that's one of my questions. Does it repattern our brain? Is there the opportunity for repatterning that I hear about in other psychedelic assisted therapies like psilocybin? Like, is there a repatterning of thoughts? Because I do have some questions about going in and supporting a person who's going into this with some like really serious intention of what they want changed.
Well, and that is, so in CAP, you set an intention, right?
Okay.
It has to be a good intention. This is where I think I'm influenced by these ideas because in therapy, people come and they're like, I don't want to be depressed anymore. Well, that's not a good goal. If you're
Yeah,
exactly.
exactly.
I mean, that's a setup for failure, right? Or I want to get rid of my anxiety. Not a good goal. It needs to be broader, right?
Or more measurable, right? Like it's like that isn't going to happen since you are a human being. There will be some anxiety, there will be some depression. And if you have a tendency towards it, but no, I hear you. So I do think intention forming is a seriously important task. Tell me what you've discovered or like what you either read through your deep dive or what you've experienced just as a therapist working so closely with this treatment.
So when you come up with an intention, right, as you're delving into this with your clients and trying to figure out what exactly it is that they want, there's something called strategizing. There was a certain protocol I loved. It was very specific, and helping them strategize what that goal is. And there's also this principle that I love. It's called inner healing intelligence. So it's this idea that all of us have this inner healing intelligence within us. And what this is, so you go to the doctor, say you cut yourself, you have to go to the emergency room. The surgeon sews you back up, but then your body produces this healing thing. It does its own work to heal this wound. The surgeon just put the skin together so that that natural process could occur. And so it's this idea that we all have inner healing intelligence within us, and that when you're undergoing psychedelics or ketamine, that you're going to let that healing intelligence guide you. And so it should even guide your goal, like your intention. Because then it would be like, it's kind of like wise mind and DBT. So dialectical behavioral therapy, where you're like letting your, you look at your feelings and the facts and you let that inner wisdom guide you. Same idea. And I love it because as therapists and as trauma therapists, we have a heavy hand in what our clients, like they're talking to us to consult with us about different things. I think it's a great principle that they are guiding what's going on, not us.
Yeah.
So And it's not like the sick part of them or the emotional part of them that's like, I don't want to do anything. I just want to feel better. It's like, really, what are the broader goals? Why are you here?
Mm-hmm.
What are your values that have brought you here? Even to
Yeah. What
therapy.
do you want? Like, what do you want to change, or what do you want? I find that in that intention setting, really getting someone to dig a little bit deeper into what they actually want, not
Yes.
what they think is possible, especially if depression's been existing for a long time for this person. It's hard to even imagine something better than the state they're in.
I know. I know. Or if they do want something more meaningful, right? It's hard for them to even be honest about it because that helpless state, like, what's the point of you
Yes.
talking about it? But
Yes.
think about this, even if it wasn't ketamine, just throw ketamine out. Just this principle about intentionality with therapy. What are your intentions here?
Mm-hmm.
What do you really want? Um, that that allows people to start dreaming, for lack of a better word, to start really honing in on, and it motivates them because
Absolutely.
therapy is hard work.
Mm-hmm.
That's the other thing, that ketamine, you have to be open to whatever comes up. So if it gives you more access to memory, that means more traumatic memory is going to come up.
Mm-hmm.
Be open to negative feelings. If their goal is just to feel better, then when they're not feeling better under ketamine, they're going to be like, it's not working. Well, maybe it is.
Mm-hmm. Mm-hmm.
But even in therapy, like, I think if people just want to feel better, that's a setup for them to be like, see, therapy didn't work. No, I mean, we have to have, and I'll talk a lot about this topic with you because it's this idea that people just want to get better. They don't understand that if it's about the absence of what you're struggling with now, it's not, it's a setup. You will think you're failing. You have to have a
Oh my
broader.
goodness. Yes. Absolutely. And just I noticed I noticed this tendency where people want to feel the way they think they're supposed to feel, which is often like from a commercial. Like, I'm not even kidding. It's from a reel, it's from a commercial. It's like not real. And I always like I feel like I'm educating often on increasing their tolerance to feelings that are uncomfortable or experiences that are uncomfortable. And that's often what we're working on, because feeling better is so uh what's the word? You know, variable.
Yeah, it's a setup too. It's
It's a
idealistic.
setup. Yeah.
I mean, it's fraught with so many problems, but I do think um that idea can be used in anything. Like, what does your inner healing intelligence think is the best goal here? Not
Yes. Yes.
this
Yes.
part of you that's wiser, whatever, right? That knows more.
Is there a place in the body that you like bring people to tap into that?
No, I try not to be specific, because I deal with
Yeah.
autism. I do have clients that struggle with interoception, and I don't want them I don't want to set them up to feel like a
Yeah.
failure, and even that. So I will just get them to abstractly, whatever it is, close your eyes. What do you identify this inner healing intelligence
Yes.
as?
Yes.
Can you access it? Let's just sit with it a little bit. And some of my clients are like, that's some hoo-hoo-y stuff. I'm not going there. Well, let's just talk about it then rationally. What do you think it is? What do you think its goals would be? If it's like
Mm,
a part of you, or like an innate wisdom, kind of like blood just knows where to flow. Your heart
mm,
knows to beat. There is like an
mm-hmm.
inner wisdom of the body
Mm-hmm.
that's very practical, that we don't have to get real.
Yes. Yes. I love that. One of the things I do is have them close their eyes and like, or just, invite them to, and invite them to disclose to themselves, not saying it out loud, not sharing it with me, nothing. Just like what they actually want, even if it feels impossible, or if like things don't add up. Like, well, I want this, but I also want this. I'm like, just all of it. What do you want? And you might include what you don't want any more of, and just get it out inside, like in the office or on the call,
I like that.
it seems like it gets something flowing when, for people who just or really feel stuck,
Yes.
which I think is a depression. Like, it's so hard to feel what you want
I
when you're
know.
depressed because you
Well,
don't
and
feel.
correct. Or all you do is feel bad. So it's like,
Yeah.
this is like almost impossible to even dream about.
Yes.
And so I do handle it with care. If their goal is to not feel this way, I'm not mean, but I because I don't want to shoot them down. I want to help grow whatever that is. I like the idea of like, you don't even have to tell me. You can sit with that.
Mm-hmm.
And maybe when you leave here, write about it, like there's a bunch of tools that are practical for developing that. And
Mm-hmm.
I think the experience of ketamine can be a resource because people can feel, this is what I'm told. I haven't had it done or anything like that. I don't know what it's like, but people can feel this intense connection in a way that they
Mm-hmm.
haven't been able to prior to this experience. And that resource we know from like parts work, from structural dissociation. I learned that in a training, that being able to feel positive allows people to be able to feel negative. Like they only feel the amount of negative that they can feel positive. Like it's this. And so
Mm-hmm.
building their positive affect or their tolerance for it is a really useful tool.
Yes.
Ketamine can produce that in this heightened state in a way that they would not have been able to experience without it.
Yeah.
Probably because it's exciting the glutamate, or, it's making the glutamate fire more.
Yeah.
This is the other thing. There's some research I found on developmental trauma and ketamine, which I specialize in developmental trauma. I don't say that, but a lot of what I do is related to that. That is like the core of how I kind of look at mental health. What
Mm-hmm.
our brains were shaped at those early years,
Mm-hmm.
through repetition, and sometimes in a bad, repetitious way,
Mm-hmm.
not like a positive kind of thing. So developmental trauma in those heightened trance states. So higher doses of ketamine create more neural activity. And so people are able probably to resource their brains, become more synapses, like synaptic plasticity occurs in those higher states. And
Mm-hmm.
brain adaptability that's occurring. They also say, let me take out the slide. I want to read the exact, because it was interesting. It's called entropy brain states.
Mm-hmm.
That's the name of it. Let me find it. Yeah. So it's a high entropy brain state on higher doses of ketamine. And what that means, high entropy brain state, it's the brain is more fluid, adaptable, less constrained by its prior beliefs or patterns, and it allows for a reset of rigid and maladaptive neural patterns. I mean, think about that.
Mm.
I mean, people that are severely depressed or struggling with developmental trauma are not fluid and adaptable. They're very, very constrained by these maladaptive neural patterns. And so being able to get a temporary break from it or a reset so they can believe that that intention is possible,
Mm-hmm.
like magic.
Mm-hmm. No, it is. It is like magic. And I do feel like it like, okay, so one of my pet peeves is anytime you listen to a podcast where someone is promoting like, or teaching about something, and it just sounds like this is the best thing in the world. Everyone should do it. And I just want to say, like, no, maybe not everyone should do everything they hear about. For this, learning, all of us learning to discern intuitively, like what might be a helpful treatment for us, or looking at the science, looking at the criteria. So I don't want to, I can get so dramatic and like Pollyanna and like, yes, oh my gosh, it's so amazing. Let's repattern our maladaptive brain patterns. Because like everyone has patterns in their thoughts that used to work and don't work anymore because they've outgrown them. And everyone has patterns that need improvement. But not everyone is at the state where they necessarily need ketamine. But for people who do have developmental trauma, PTSD, maladapt, or treatment-resistant depression, this is something that is being shown to support their treatment and to help their brain repatterning.
Well, and I want to kind of piggyback on the harm idea because it can harm them.
Right.
About this.
Everything has risk, even therapy.
Yes. Well, because if they have this window, right, where they experience more of their trauma history and they don't have the support or the tools they need, that can actually destabilize them when they come out of the treatments, right? And this is where I think as therapists, we have to be careful. People are in such a suggestive state when they're going through ketamine, even after it, that we have to be really careful that we don't mess them up.
Yeah.
Further. And that's why I think the inner healing intelligence is important because it dictates all things. Oh, are you feeling too much? Okay, what do you need right now? What does your inner
Right.
healing intelligence say? Well, I need a resource. I need to not talk about this anymore. Okay, let's come up with a resource.
Yeah.
What is it going to be?
Yeah.
Is it a place? Is it an experience? Is it a place in your body? Is it a place that you go mentally? What is that resource? I do think that it has the potential to harm people, especially if not done with the right support. Some of these like chronic mental health issues, if you do trauma work, there's this fragile.
That's the word fragile is exactly what was coming to. It's like we are holding a fragile glass orb or an egg. We're holding something really fragile. Yes, absolutely.
And teaching people, our clients, how to be more what's the word, adaptive and not so fragile, right?
Mm-hmm.
How to be resilient.
Yes.
That is the hope that I give all my clients. But I think ketamine can create that, right?
Mm-hmm.
For some people, they don't need their therapist supporting them through this, right? On the outside. But for other
Mm-hmm.
people, like those breakable clients, we can be really helpful in just reinforcing when to say no, when that's enough, what to tell the clinic, like things that people who are more resilient would be doing. Like, hey,
Yes. Right. Yes, absolutely. People who have a sense of agency could do that. Yeah, absolutely. And I mean, it's a treatment for people who are in a fragile state more often than not,
well, which is why I like the IV because it can be stopped.
Right.
And they can come out of it when they feel like it's too much. Once you take a pill, they do the pills like the lozenges slowly to see what you can tolerate. But once that's in your body, you got to ride it out. I don't know how long that takes.
Sure.
Get it out of you. Whereas IV, you can. I think there's a lot more work to be done on this whole protocol for even those difficult cases, so that there aren't as many negative outcomes. I think the New York Times, somebody wrote an article about like some of the negative side effects of it. And I'm sure it's because, people were taking a large dose and not able to reverse it. And if they are prescribed it at home, they're at home taking them. I mean, you don't have
Yeah.
there's just a lot of things that could change in the protocol. But look, I didn't do research on the lozenges, so I can't talk effectively about
Right.
it. But it makes sense in our clinic why we do it the way that we do it.
Keisha, do you notice people, so depression, kind of protects us from feelings. Lots of emotions are suppressed. We're not experiencing this range of feeling, of caring, of, so often treatment resistant depression, people are so low, they don't care. There's so much apathy. And then I notice like coming out of that, and maybe that is because the glutamate
Yeah.
starts being more usable in the brain. But do you notice that it's difficult for people to feel so much, to care again, to have that range of emotion? Is it outside of their window of tolerance, or are they able to meet it when it happens?
Well, just the few cases that I've observed, they are able to meet it.
I have too. I've noticed the same thing.
So it's interesting, but I think it's because it's happening in the brain.
Yeah.
it's chemically changing the brain. So, and some of the stuff they say is that ketamine does make for a better window of tolerance and more it's like it manages your emotions better. So you're
Mm,
able to manage your moods, right? Because glutamate is about managing moods. I don't know
mm-hmm,
enough about glutamate, but what I do know, it manages moods. And so that part of the brain probably allows for better use of that. And
mm-hmm.
if we're more adaptable, right? If we're neurologically, if our neural networks are creating synaptic plasticity, right? Then that would mean we're more adaptable. And so we would be better able to handle moods,
Yeah.
different feelings that come up. Even the feeling of, wow, I'm better than I ever thought I would be, which
Mm-hmm.
can be disorienting for people. See, I do have some clients, not through ketamine, but through just traditional like trauma work stuff. They'll feel like, oh, I'm happy. And it's disorienting for them, right? Like
Oh,
that, like
yes.
something bad's gonna happen because I feel okay.
Something bad's gonna happen. Yep. Absolutely. And that's an interesting pattern that I also encounter.
But I do find when people are successful, probably so here it's like 6 treatments they get for ketamine, that they are creating a slower change with that, right? And if their inner healing
Mm,
intelligence is in charge, they're only handling what they can.
mm-hmm. That's absolutely.
Think of it, they're leaving the office, something bad happens. So what did you do to handle it? Right? You're
Mm-hmm.
reinforcing what happened when the brain was firing better. And so then they're like, oh, well, I'm gonna go for a walk, or things we've talked about forever, right? I'm gonna put
Right.
it in a box, whatever, right? A visualization, right? Yeah.
Have you had anyone stop their treatments early because it was too much?
No, but I know that happens. I know that
Yeah.
there, I mean, I could see, but often I would think in those cases I'd want them seeing a therapist, that adjacent psychotherapy, just to kind of assist
Right.
in what was the problem, how do we empower them. I mean, even the just the activity of ketamine empowers them, right? You're going to do something
Yes.
that you know is hard, you're going to force yourself to do it, right? So it's like this
Mm-hmm.
kind of like ERP. You're telling this part of your brain, like, see, I'm ready. I'm going to do this. And I know it's going to be difficult for me, and I'm going to do it anyway. And I'm going to have the tools I need to do it and to feel
Mm-hmm.
successful at the end of it that I did do it. There's something in that, just
Yeah.
that,
Yeah.
without the brain changes, right? Just the behavioral piece for it. But I'm sure there are people who don't have good outcomes. And, I mean, there wouldn't have been that article in the New York Times. I'd want to
Right.
know.
No. Yeah, and I think like it's just like with everyone, uh, there's varied outcomes, you know, metabolism, the way that our brain can metabolize medication, chemicals, I mean all of it, you know. So it's nothing is ever works for everyone.
I
And I
know.
never want to put something out there that makes I can be so like I described, like just dramatic and Pollyanna and like excited about things. I can be excited about things. Could easily sell things. And I just want to say like because I've learned my power of influence over the course of my adult life, I'm like I think yeah, it's so great that we're learning about this and discovering these things. And as with everything, it's like follow the guidance of your providers, follow your inner healing guidance. Um, and I think that like often with mental health treatments, we are always weighing the risk of where the person is already at and the risk of the treatment. Even with
No.
medication and side effects, right? It's like, well, are these side effects better or worse than what you're up against right now, which might be like suicidality or, severe symptoms. And so I do think like there's always, a weighing of risk.
Well, and for psychedelics, there's just not I mean, we're at the beginning of that,
Yes.
which
Yes.
I want to also talk about this idea that this was not created by modern man, right? Psychedelics have been around for a long time. This is
Right.
old
Right.
medicine, old medicine. Um, and it probably isn't given the right I don't know, the right contribution. We are not creating anything new, but we're systematizing it or creating a
Right.
system where we can have better outcomes, and we can, that's how we do in medicine today. But it comes from
Yeah, no, exactly. There's some such great information out right now about that as these movements. I mean, I have mixed feelings about any regulatory system taking over medicine that's been around, since before these systems existed. Um, and I mean, even just like, yeah, I mean, we could get into so many topics. I was riding my bike to work today thinking about what will marijuana being legalized look like in our country? And I was thinking about the changes after prohibition and like what does history tell us? I don't know what it does. I'm very curious. I want to read about like how did people treat alcohol after prohibition? Because marijuana was legalized in Minnesota this year. But I'm curious about how like access will change to psychedelics if they're regulated um and there's like quality control and like laws placed on something that people historically have had access to. And I mean, I have so many mixed feelings about it. But I guess in general, with ketamine specifically, like where is ketamine sourced from? Do you know?
No, but it's been around for a long, long time, and it's cheap. Like true ketamine is very cheap. Administering is not, but I don't know. This
I'm
and it's
looking this up.
because it's made for what they're administering in these clinics is very baby doses, right?
Mm-hmm.
But it was, I mean, like minute. What they give people in the hospitals as like to knock you out, um, that is like way more. I just know the people that administers talk about how small the dosing is in comparison. And it's a medicine that we've had a long time, so we know about it. I think
Mm-hmm.
I want to say one of the benefits about systemizing it in this sort of way is that there are a lot of people who would never take like mushrooms off the street. But if it was legal and it produced good outcomes for them, and it was, had a medicine kind of label on it, they would take
Mm-hmm.
it. And if it had
Yeah,
less
no,
side effects,
totally.
so it becomes
I get it.
and I don't know what the right choice is, but I definitely think there are answers in this somewhere.
Yeah. Well,
Yes.
okay, so ketamine was first synthesized in 1962 and used as an anesthesia. And then, of course, like with most chemistry, they discovered all of the varying uses of it and the discovery of it working as a dissociative anesthesia. It was FDA approved in 70 and first used for soldiers in Vietnam War as an anesthesia. Whereas like, psilocybin, it's like when you get into these plants, I hear what you're saying. And I hear that too from people who are very curious and um they're just so afraid, they feel like something might work for them, but they don't know how to access it, where to access it. And if it's not legal, then it's very scary, I mean, there's just so many barriers.
Well, right. And so I do think it would allow, if it becomes like, it would allow for treatment or access to treatment, probably, hopefully in a cheaper way. That my hope with so S-ketamine is the nasal ketamine. That's way expensive, right? But your insurance pays for it. It doesn't work as well as ketamine. Ketamine is super cheap, but because of all the regulations around it, hard to administer. It's expensive to administer, right? And your insurance doesn't pay for it. Um, Mushrooms, my hope with that would be that it would be cheaper again, so that everyone has access to this type of
Mm-hmm.
medicine if they need. Because I'm
Mm-hmm.
always thinking of availability for all. It shouldn't just be
Yeah.
this sort of you have money so you can afford it. And the way it is now, yeah, it's expensive. I think a
So,
lot
and
of
I was just hearing that there is a shortage of ketamine, IV ketamine here.
possibly.
It was difficult to access and similar to other other medication shortages that have
Yeah.
occurred since the pandemic, that there was difficulty with supply issues.
Yeah. Yeah. I
That's
don't know.
just that's just what the person next door mentioned to me, that it was getting harder and harder to find it and keep. I mean, it is expensive,
But it's,
but to keep it within that range that her,
yeah.
price is at.
Well, and I know for them in the last year, so many clinics, or the last 2 years, tons of clinics for ketamine popped up in the United States. Like
Mm.
part of why the shortage is happening. I know that much. They didn't have a lot like 5 years ago. When the company started, it's Neuromed. They didn't have a lot around the country. And now I can't remember the number, but it's a large number have opened up.
Mm.
So I think that's contributing to it as well. But the stigma, I've seen a stigma change in 5 years. It's crazy. It might even been 7 years. It's back then people were like, what?
Yeah.
And now
I
it's
mean, all
like,
I knew about ketamine was like, it was like an illegal party drug. Like,
right.
like just from being a young adult, like that's where the only place I had ever heard of it. I educate people often, just not in my office necessarily. I haven't like really introduced it unless someone came in already knowing and was like, I have questions. I think this might be right for me, just because I haven't like gotten trained in it. But just in everyday life, I'm like, no, it's not a party drug. It's actually something that is being used therapeutically, and is legal to be used therapeutically. But I was looking at your presentation, and I had just in like the prep sessions that you do, and empowering them to stay safe or comfortable. Tell me just a little bit more about like how you support them to stay with their inner healing guide, and to integrate.
So integration, I mean, it can happen during, but that's where they're integrating everything they learned from those experiences, because it's like a spiritual experience into their lives. But in the beginning, we're helping them. I feel like as therapists, our job is about empowering them. And in this type of experience, we're empowering them to trust their inner healing intelligence, to know when they've had enough, to resource, whether it's with a weighted blanket or a visual, because it becomes a very visual experience. So they often have like,
Mm.
I don't know, like if they feel connected, they're like, I feel connect. And it's like this magical connection they
Mm-hmm.
feel. So, and they decide, right? So they're in
Mm.
there. Sometimes they have a loved one with them that's not abusive, that's truly supportive, who
Yeah.
like going through the process with them, that'll hold their hands. Therapists, there's been some sexual stuff because therapists often holding their hands is very grounding, or, but I think something sexually inappropriate happened. I don't know, stuff I read or
Sure, of course. I mean, I do think, as we like, do you remember well, is it in EMDR? Is there like foot touching?
yes, an EMDR.
Yeah, okay, so in EMDR, sorry, I'm not trained in EMDR. Keisha is trained in EMDR. So I remember just in us talking over the years, like there's there's like controversy and like, do we touch the foot or do we not touch the foot? And consent, and like there's just so many barriers to touch in therapy. I mean, there's like, we're going from like psychoanalysis where the person doesn't even get to look at the therapist because they're sitting in a chair kind of behind. I'm not even kidding. I mean, traditional psychoanalysis is like, truly they're sitting off to the side and behind, and you don't even get to like look in the eyes of the psychoanalyst. That's so crazy to me.
That is hilarious,
So
right?
now we're like, is it safe to touch a foot or a hand? And I mean, of course, like for some people it's not, and for some people it is, and we have to have consent. And
And the whole idea of that's a whole ethical, I found a whole presentation on that, the ethics of ketamine assisted psychotherapy. Really interesting. Of course, I downloaded the whole thing. I was really interested in that. But for the purpose of the way that I'm talking about it, which is just, we're not even in the room with them. So we're
right, exactly. Same with me.
to have safety while they're in that room, whether it's a nurse that they feel really close to at the place, somebody they love going with them. I think people have brought their like animals. So like if you have a
Sure.
what
Support
is,
animal.
yeah, but like registered, you can't just,
Yeah.
and you have to have like the right paperwork for it. Some people have that. Some people resource through fidgets, through weighted blankets. They listen to music from God, which there's music from John Hopkins. There's like a playlist you can listen to, which is better than your own music. And so they listen to that. There's
Because
different
you
ways.
don't have like association with this music versus, yeah, totally.
Correct. And it ends up being super visual. Like they'll have like, I don't know, maybe they imagine themselves as a tree, and the tree has these little roots that are connected to the earth. And so, you know, if that becomes a resource when emotionally they feel like they've had enough, they can't feel anything anymore, like it's too much, they can go to that resource. I mean, there is a probably an art to it, right? That you're just coaching them on, and they're figuring out while they're going through it. So it's
So Keisha, does the clinic like do they share notes with you? So like in my collaborative situation, she documents everything and she'll take notes. Like the nurse practitioner will take notes during the session.
so
And then
she's sitting with them then.
she's sitting with them the whole time.
That's cap. So that's
But it
ketamine.
is IV.
I know, but it is what she's doing.
Gotcha.
So when they're sitting and writing everything down, that is ketamine assisted psychotherapy.
Gotcha.
Right? You are not a part of it. You're writing everything and you're going to give it to them, or you can give it to their therapist. So I'm in a clinic where they don't do that. They're administering
Gotcha. Okay.
room. They check on them. You know, they're hooked up. So yeah, but what she's doing, that's cap. I know that 100%.
Okay.
Because cap doesn't, you don't get involved. You write it down, you watch, you might meet with them after their sessions when they come out,
Yeah.
right? Because when people are under, they don't want to talk. Yeah, it's
Right.
not,
Right.
it's intense. So you're just documenting what they're saying. But that stuff. So what I have them do is after they're done, they go home and they write about it. Or they do
Yeah.
some artwork or some self-reflection without talking to people about it.
Yeah.
You don't want it tainted. I know
That's
that sounds
awesome.
crazy, but
No, no,
because
no. It's totally.
it's suggestive, it's difficult, you really need just support to explore it. This is where our skills as therapists, just being non-directive, really, really good. We would just summarize. We're not leading them anywhere. We're not giving them answers. We are just supporting and nurturing their unfolding. So, and I think that the reason harm happens, people are in this open suggestive state, and it probably makes them more vulnerable. And if there is a therapist who is going to be sexually inappropriate, it will breach that. Okay, that's the gross negligence, right? Sexually inappropriate therapists could harm their clients in those times, but also well-meaning ones could be too direct. And you don't want your answers overriding their own inner healing intelligence. You want their inner healing
Absolutely.
intelligence guiding the experience, even when they're outside of the treatments, because they're suggestive. They're too vulnerable. Like you really need to not be involved in what conclusions they're coming to.
Yep.
But they can share it. Yeah.
Yeah, absolutely.
Yeah.
Absolutely. Okay, the reason I was asking is because those notes were like the client's kind of guidance in the unfolding, you know.
Well, yeah, that to me is the
But I didn't think that that was absolutely necessary. So it's interesting that you're describing experience without things like that. You have them explore it themselves. What did they take from it? Because I do think that when someone is there documenting what the person is sharing, it's just like could be totally out of context and they may not have any idea, especially if it's such a visual process. The verbal expression is not going to really, it's like trying to talk about a dream. We just lose so much in that interpretation. And so, you know, explaining, like, I don't know. I can see how, I'm sure there's a benefit to that protocol. That's why it exists. And I can see how the
it
absence of
allows
that protocol has its own thing.
Well, and it allows for non-direct involvement, right?
Mm-hmm.
Because we're writing it down, non-direct
Mm-hmm.
involvement. And it ends up being a story. All their journeys, because they call them journeys, end up being one
Mm-hmm.
story. And it
Mm-hmm.
is very dreamlike, lots of visual. That's why I think the creative, like making art out of it, out of the images, could be really powerful. Because we don't, an image has so much more meaning to it than the words we
Yes.
put.
Yes.
And so if they had a tree with roots, I would say you need to have that tree with roots so you can look at it and,
Yeah.
revisit whatever that is. But again, uninvolved. I'm a
Yep.
bystander of the journey unfolding and I'm supporting it. How do I support it? I'm just like, what does your inner healing intelligence say we should do? I mean, and
Yes.
most of the time clients have an idea and they can tell you, most of us, if we're working with a client, we have been for a long time. So we know
Totally.
these are people who've been in therapy most of the time, on and off throughout their lives. So they kind of know how it works. I haven't had
Mm-hmm.
one that didn't know an answer. If I'm like, what does your inner healing intelligence say about that? If they're struggling with something, they're like, oh, well, that, okay, I should do blah, blah, blah. Or, you know, I should accept this, or I should go for a walk, or I should pray in the morning, or whatever it is, right? They don't have an
Absolutely.
answer. I haven't had one that was stumped. And if they were, I would be like, oh, okay, well, maybe that's something you need to sit with
Yeah.
and see what's gonna come to you. I
And
bet
maybe that's a testament to like your space holding for that inner intelligence to come out, that inner and healing intelligence to peek its little face out and express itself. Because I do think that, I mean, I think that's part of our role is what kind of space do we hold, you know?
well, yeah, because we don't want at the end of it for them to be like, you have all the answers.
Yeah.
Okay.
Oh my
What
gosh.
have I given my clients then?
The worst thing is like that when they come in, they're like, so I did what you said. I'm like, oh my God, what is about to come out of their mouth? Like the way things are perceived.
I
I
know.
always get a little stomach flip when someone says that. I'm
I
like,
know.
wait, can we go back to the
Yeah. What did you hear me say? And yeah. I mean, but the greater thing underneath that is then they will always need us, right? If we are
Yeah.
the ones with the answers, they will always need us, and that hierarchy that exists in therapy will continue to exist. Whereas
Yeah.
if I've done my job well, you will not see the need for me. You will believe
Yes.
in yourself, you will trust in your ability to execute XYZ, whatever it is, and you won't need me.
You
I
will
mean,
have the ability to access that internal system. Yes.
I know. Yeah. So, we
Okay,
can
so
figure it
Keisha,
out.
as we're wrapping up, anything else that just feels important to mention from your deep dive?
I think that as therapists, we need to be really careful in how we support our clients. And if you're not trained in trauma work, you probably will mess them up. So I would not get involved too much, I would really trust the facility to do their job. Um, and communicate with the facility if you need. Have a release sign so you can talk and find out if there's something they would suggest. They are in a very suggestive state, and just because it is medicine and it does help, you don't want to contribute to it being worse or them being worse, right?
Mhm,
Unknowingly.
mhm.
Yeah, so that would be my big thing. Handle with caution, extreme caution.
So, one more question, actually, this just came up because, over the history of being a counselor and even actually prior, I always, and I wonder if this is kind of along the same lines. You know how EMDR can really destabilize someone? An EMDR is bilateral stimulation that is stimulating both hemispheres of the brain, right? To access things that are like difficult to access without that stimulation, that back and forth stimulation. And so you've taught me that to really, and I saw this kind of in the recovery world, there was a pattern I picked up on over time that was like, oh, people with long-term sobriety sometimes relapse after going and starting EMDR. right? Like I saw that a handful of times and I was like, whoa, this is like feels like a bit of a pattern. But then when you kind of explained to me that prior to someone being ready for EMDR, they need a lot of lead up. They have to be stable to a certain level and have a lot like a certain, and I might be saying this incorrectly, so correct me, but they have to have a certain level of like resources created or established and this whole like support structure to go into EMDR quote unquote safely, or because like we don't always know what we're gonna find.
Correct.
But it's making me kind of think about that, like the way that we support when we stimulate the brain, when there's certain types of mental health issues, depression or PTSD or whatever, like stimulating that brain it can cause destabilizing.
Correct.
Yeah. Okay. I'm totally, and I wonder if like your training in EMDR, because you've been trained in it for a really long time.
Yes. And other trauma
I was
processes.
going to say you've done other trauma
Mhm.
training piggybacking off of that and deep dives into brain and trauma healing.
Yes.
So I wonder if a lot, like if that, it just really contributes to your understanding too of this treatment and this method and how to support and hold space.
Yes. And how to practically teach our clients to stabilize in the face of destabilization, right?
Yeah, like to adapt and to be
Right.
practice their own resilience
Correct. And I think that
or
does
figure
inform,
out where their resilience lies, right?
correct. It does inform how it'll work. I think that this does provide a way for that to occur quicker. That's my
Mm-hmm.
observation. People that were stuck in the stabilization phase, when they would get ketamine, would then respond quicker. They could stabilize so much better.
Yeah.
So there
Yeah.
is potential, right? The potential is for this magnificent change to occur. Um, and often it can occur without us doing anything. We don't even need to be involved,
Mm-hmm.
right? Like some clinics don't have therapists involved at all, and people still get better at high
Right.
rates, at high rates. And so with that knowledge, then it's like, okay, so maybe less is more. So maybe we're just the assistant in this process. And seeing ourselves as just an assistant really allows us to do no harm and to let the medicine do its work. Because if
Yeah.
psychedelics have been here long before any of this shit has been here, right? If this is medicine that is old, um, then really we don't need to be involved, right? We can let the medicine do its work and trust that it is doing what it needs. Like maybe that is
Mm-hmm.
higher, maybe that has the healing intelligence in it as well. And it is about us just holding space for that. Yeah.
Mm-hmm.
Oh, I like that.
Mm. Yeah, I know we gotta wrap it up, but there's some studies after 9/11 and like different, and you and I both did outreach crisis counseling to impacted families after Hurricane Katrina and Rita. But after 9/11, they did a study where children, adolescents were three different models. One was ongoing therapy, just like ongoing therapy because they were affected by 9/11. Or lost a loved one to it. The other one was some education, some psychoeducation and brief therapy, but really treating them like they have what it takes to get through this. And
Hmm.
then the other one was like only psychoeducation, so just like some information but not brief therapy. And the ones that did the best, actually those two had similar outcomes, but the ongoing therapy was the worst outcome because the children perceived themselves as being not well.
That is crazy.
I know. I haven't read that study in a long time, so like I'm trying to be careful in how I repeat it because my memory might be failing me. But I remember that that was the worst outcome was the ongoing therapy. And it made so much sense. And actually, I do tell that to people. I often am like, I want you to check in with yourself and and I want you to feel how you're doing because you've like met a lot of goals and you have changed a ton. And this might be like a good time for a pause in your life and to go and like use like just take some integration time, because the last thing we want is for them to get dependent on us. There's so much information about there, especially Gen Z. They're like, you need a therapist. If you haven't gone to therapy, like something's wrong with you, like all over TikTok and all over the internet. It's like, I'm not kidding you. They're like, you're either in therapy or you're like garbage. And they're kind of like all up in your face about like getting a therapist. I know it's like beautiful and like, okay. Like, I think
Right.
that's also called a friend. Like, so like a support system of your peers that could do some of that for you too. And like, this is not like the solution for our isolated lives, you know?
Correct. Correct. I don't even know where we started on that, but I was like, yeah, that sounds true.
Yeah, just like like letting their inner healing
Yes.
intelligence guide them. Yeah, and doing
Yes.
less sometimes is more.
Yes. Yes. And if their inner healing intelligence, if they're able to access that, they won't need us. They'll know the answers.
Yeah. Yeah.
This is the crazy part, right?
Yeah.
That is the answer. And
Yes.
like as therapists, really, what are we reinforcing? That's what I wanted to say. There is some motivational interviewing stuff that I've been talking to another therapist about that I swear I want to do a course on. It's like, what are we reinforcing? If we're reinforcing something's wrong with you, we talk about your sadness and your trauma. Maybe that's not great. But what if we're reinforcing, like in DBT, what did you do different? How did you manage that? Oh
Yes,
my goodness,
exactly.
amazing. Oh, and we're celebrating their victories. Like maybe that type of motivational interviewing and therapy is really the secret to being a successful therapist. Like really it's success in your clients through this type of guided, I don't even know where we're funneling them. Yeah. Okay.
Yeah.
Whole nother podcast that we're hitting
Yes,
on.
so thank you all for listening. If you made it this far, you noticed that Keisha and I kind of veered off of our topic of neurodivergence, and we just decided spontaneously, we're going to talk about what we're learning about, what we're excited about. We're still talking about neurodivergence, but today we're talking about ketamine and the use of it as a treatment for some mental illnesses, and Keisha's deep dive into learning all about it.
Yes.
So stay tuned for more, um, you know, exciting geeking out with us in our therapy topics.
Thank you.
Okay, until next time.
Bye.